It's exciting to say, we have the potential to reduce the number of lung cancer deaths by 50% with more aggressive screening. Currently, 160,000 people a year will die from lung cancer. And with screening, we can perhaps lower that number to about 70.
Who should be screened for lung cancer are patients from the ages of 55 to 75, current or former smokers with at least a 30-pack year history of smoking.
Pack years. A pack year has to do with the number of packs per day smoked times the number of years. So 1 pack a day times 30 would be a 30-pack year, or 2 packs a day times 15 years. Anytime that number is greater than 30 and that somebody's either actively smoking or quit smoking within the past 15 years, they'd be a candidate. The final criteria is age. It's been shown that under age 55 the benefits aren't there, but over age 55 with the 30-pack year history of smoking within the past 15 years that they benefit. To qualify, talk to your physician, because like any test, there's a pro and a con to it. And while more people will be served well and we can identify cancer early, there is risk to screening. There's the risk of radiation, there's costs involved in it, there's the possibility that further testing, that is some of which is invasive and carries risk. So every individual has to sit down with their physician, I believe, and talk about the pros and the cons. Chest x-rays have been shown long ago not to be very beneficial, and for years the CAT scan has been talked about, but nobody had any information. Several years ago, I want to say within the last year and a half, they've finally been able to come out with a study that showed that in high-risk individuals, we can help more people and identify more early cancers with CT screening.
This low-dose CT scan is lower radiation exposure, safer, and gives us a better picture than a plain chest x-ray, and therefore is a better screening modality for earlier detection of lung cancer.
Depending on what they find, and to be honest, most people are going to have some abnormality. You live through life and you develop little nicks and scarring and whatnot. So if they find something, there are certain criteria that the radiologists will use to say this has a higher probability of being something more serious. Based on the size of the nodule in the lungs, if they find one, they'll make recommendations. Once an abnormality is found, though, it then moves from being a fee that the patient pays to falling under insurance recommendations, so our insurance guidelines. So any abnormalities should be covered by insurance. It's that initial screen that may not be.